Hi, I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville. Welcome to this week's edition of Kibbitzing with Kagan. I have with me a very special guest, Vinny DeMarco, who has had such an incredible career of making a difference. We're going to talk about a lot, but let me first welcome my longtime friend, Vinny DeMarco. Thanks for taking time to chat today.
Thank you for having me. It's been a pleasure knowing you since 1980 and doing a lot of great stuff together. You're a great leader.
Thank you so much. That's kind. And folks, I did not pay him to say that. All right. So Vinny, start with your childhood. Where did you grow up? How did you get involved in politics? What first inspired you?
Well, I was born in Italy and my family moved to New Jersey in 1961. And then I came to Baltimore as an undergrad at Johns Hopkins. And then went to Columbia Law School and came back to Johns Hopkins for grad work in American history and fell in love with Baltimore, Maryland, stayed here, met my wife and have kids here, and just really enjoy Maryland and Baltimore. And this is where I will live the rest of my life. And I've always wanted to be involved in public policy. And that's why I went to law school. That's why I went to graduate school. And my first involvement was, as you know, gun violence prevention.
Okay, we're going to get there.
Okay.
I've got the questions. So first off, did you have an early mentor?
Oh, yes. I had an early mentor, a wonderful teacher in grade school who really made me think about public policy and made me think about how to make the world better. I will always remember him.
Why don't you say your teacher's name?
Mr. Shanker. I can't remember his first name, but
that's okay. That's all right. He deserves a shout out here.
Yes, thank you.
They don't get the love as often as they should. So, so Vinny, let's start with gun violence. Unfortunately, still too relevant today. So you worked in it. I worked with Jim and Sarah Brady. Why don't you talk about what you accomplished in Maryland through your leadership back in the forever ago?
Forever ago, but
yeah.
Even forever ago, before that, in 1968, I was a little guy when Robert Kennedy and Martin Luther King were shot in 1968. And I remember just being so torn apart by that, and just having it in the back of my head and in my heart that someday I was going to try to do something about that. And then in the late 80s, there was a Court of Appeals decision, highest court of Maryland made a decision holding these manufacturers of Saturday Night Special cheap handguns liable for deaths and injuries caused by their guns. And of course, the gun lobby immediately tried to overturn that law in the legislature. So I immediately became involved with another one of my great mentors, former Attorney General Steve Sachs.
Great guy. We just lost him. Yes.
Yes. We just lost him. And he and I built a campaign to protect that law. And that was followed by another wonderful mentor of mine, former Attorney General Joe Curran.
Yes. Whose daughter is running for Attorney General. Okay.
Yes.
So let's fast forward to today with all the tremendously awful, tragic, horrific gun violence. It's not your day job, but any thoughts on what Congress or the state should be focused on?
Well, with the help of leaders like yourself in the General Assembly, Maryland actually has some of the best gun laws in the country. Gun violence prevention laws that ban assault weapons and high-capacity gun magazines and require a fingerprint license before someone can purchase a handgun. Very reasonable. If these were the laws all across the country, we would be a lot safer. And I'm proud to say that Senator Chris Van Hollen has introduced national legislation modeled on what we've done in Maryland. This has to be done nationally. And just really important for people to remember, when President Bill Clinton and Senate Judicial Leader Joe Biden passed the assault weapons ban in 1994.
I was one of the lobbyists.
Yeah. You were one of the lobbyists
Yes.
of the Brady campaign.
Yep.
That law, which also banned high-capacity gun magazines, was in effect for 10 years.
Yeah.
There was a dramatic reduction in these kind of horrible mass shootings. It works. Assault weapons bans, high-capacity gun magazine bans work. Sadly, it was allowed to lapse in 2004 under George W. Bush. We need to get that back. These laws work.
Yes.
New Jersey has so many fewer gun deaths than Pennsylvania because they have fingerprint licensing of handgun purchasers. So if we did those two things nationally, we could have a lot safer society.
Great. Let's pivot to what you're doing now. You are the founder, the president of Maryland Citizens Health Initiative, Maryland Healthcare for All. And you have done such extraordinary work. You established it in 1999. Why don't you talk about the history, how you decided to start it, and then we'll talk about some of the what you've already accomplished and what's next. But start with the history, if you would.
Well, kudos to former Baltimore City Health Commissioner Peter Bielenson, who in the late 90s was, like many of us, very frustrated that the Clinton proposal for expanded healthcare failed.
Yes.
And he brought a group of us together and said, let's try to do it in Maryland. So we created the organization, and I'm just so happy and proud to say that we've been around since 1999. And what we've done is built a powerful coalition of hundreds of faith, community, labor, business, and healthcare groups from one end of the state to the other, everywhere, whose goal is to achieve quality, affordable healthcare for all Marylanders, and to understand that that's not an easy thing to do, and it takes time. And we have made some tremendous progress in Maryland.
So actually, one of the questions I had for you was about coalition work, because there are a lot of us who have worked in coalitions, and it doesn't always go smoothly because everybody's got a slightly different agenda and leaders that want to be in the spotlight and stuff. Give us some tips. Anyone working in coalition could certainly benefit from some of your many successes, but how do you work in a coalition and make it thrive?
Well, the number one thing I'd say is listen. Listen carefully to what your potential coalition partners, your present coalition partners have to say. When they raise concerns about direction you're going, listen carefully. Nobody's going to ever get everything they want, but people appreciate it when you listen to them and take their views into account. Second lesson I've learned is take your time. I have seen people say, well, the legislative session starts in 3 months. I'm going to build a coalition. Not the way it works. If you really want to build a strong coalition, give it a year or two. Take your time. There are some organizations that meet once a year. Accommodate that.
Yes.
Go to that organization and talk with them on their terms. Listen to them. And another very important lesson, I believe in this like a Bible. Have a one-page document for organizations to look at. Not 2 pages, not 3 pages, not both sides of a page, 1 page. We call it the one-page rule. If you think very hard and it comes down to 2 pages, start all over again and make it 1 page. Because you're going to a busy person, a pastor or a rabbi who's busy with weddings and births and deaths, head of an NAACP chapter who's very, very busy. You want them in 1 page to be able to see all they need to know and decide whether they want to be with you, and leave them something that they can sign and give to you. Of course, people will want more information. You have website, you have other information, but have that 1-page document.
Yes.
And then one other very important lesson, take advantage and use and work with organizations that have networks. For example, we always work closely with faith communities. One of the most important ones is the United Methodist Conference, Baltimore, Washington Conference. And they have a great network. When they endorse something from their bishop, they have 500 congregations. They can mail or email the resolution to all of them. So you build your network that way.
Nice.
So I think that those are the kind of tools we've used to really build, like on our Prescription Drug Affordability Coalition. We have the biggest coalition in world history, over 450 faith, community, labor, business, and healthcare groups that are really working together to make high-cost drugs more affordable for Marylanders.
So before we get into healthcare specifically, may I just say that 1 page is all that it takes, almost always, for legislative advocacy. It's amazing when people want to hand me a document that's this thick with citations and footnotes and all that stuff. If I want that, I will ask for it, but generally give me the facts. I need enough details to understand it and decide whether I want more. But yeah, it's amazing. People don't know that. Okay, so easy enrollment. Over 400,000 people. Maryland was the very first in the nation. Talk about what that is and why it's so important.
Well, the heart of our success, of course, is President Barack Obama's Affordable Care Act. That was really a game changer, the most important healthcare law since Medicare and Medicaid. And over 20 million Americans have gotten the healthcare they need. Unfortunately, as you know, Senator, not every state has done everything they need to do. It's really a tragedy that some states have not taken up the availability of expanded Medicaid, et cetera. In Maryland, and I'm going to say that they're Democratic and Republican governor, we have had the best exchange in the country, and we have fully implemented, fully expanded Medicaid, fully done what needed to do to make the Affordable Care Act subsidies work. So it's really been great. But in addition, we've gone farther. And again, thanks to you and your colleagues, we have a reinsurance program, which makes our premiums lower than most other states, and the easy enrollment program of 2019, which allows people to, at tax time, check off a box that says they're uninsured, and then say, and you can share my information with the exchange to get me enrolled. Thousands of people who didn't know about the healthcare have gotten enrolled, and senators, several states have followed our lead.
Yes.
Haven't enacted them.
So we still have 6% of Marylanders that are estimated at still not being enrolled. Why don't you talk about who those folks are? Why are they so hard to find? And what are we doing to try to get them health insurance?
It's a great question. I think you can think about the uninsured in three categories. One category are people who are eligible today for free or very low cost, like $1 a month healthcare, but not enrolled. And why is that? For many of us, but particularly many of us who are lower income, it's tough to do things like sign up. You get a letter and it gets lost. It's just,
I don't have a computer. It's broken.
Yes.
I don't have wireless. I don't have access. I don't speak English.
Exactly.
You
understand. Yes, you understand this completely. We believe, well, easy enrollment was a step in the right direction. Thank you for that. But we believe the real answer is something we call automatic enrollment. We believe that if the state of Maryland knows that you are eligible for Medicaid or free or low cost Affordable Care Act coverage, we should send you a letter that doesn't say do this in 30 days. It says in 30 days, you and your family will be enrolled unless you opt out.
Opt out rather than opt in.
Yeah, exactly. Nobody's going to be forced to have healthcare, but we believe that this would enroll tens of thousands of people, which would benefit all of us. Because when people don't go to the emergency room, that doesn't increase our hidden healthcare tax of uncompensated care.
So I was exactly going to ask you that question. I'm a wealthy family. I have health insurance. My neighbors are all fine. Why should I care? Other than being a good person, why should someone care about that 6% or the person down the street who isn't covered? How does it affect me in the Donald Trump era of me?
Well, luckily we're in the Joe Biden era now, but
luckily but there's too much lingering.
Yeah, I understand completely what you're saying, Senator.
Yes.
And as you may know, one of your and my heroes, House Speaker Mike Bush, when we were pushing in 2007 for Medicaid expansion, he came up with the great phrase, hidden healthcare tax. In Maryland, it's direct. In other states, it's indirect, but in Maryland, it's direct. When someone goes to the hospital and can't pay their bills, there's an uncompensated care fund that makes it up out of your and my premiums. So you and I pay a hidden healthcare tax for the uninsured. When we get folks insured, that hidden healthcare tax goes down.
Perfect.
We all benefit. So that's category number one of the people who are eligible but unenrolled. Automatic enrollment is the way to deal with that. There's a second category of people whose incomes are above the level of Medicaid and above the level of really high subsidies under the ACA. They get some subsidies, but not quite enough. Now, Massachusetts has 3% uninsured because they have substantial state subsidies.
Mhm.
And we want to have additional state subsidies. Now, your two colleagues, Senator Brian Feldman and Delegate Ken Kerr, had a bill passed a couple of years ago, which provided additional subsidies on a pilot basis for young people. $20 million a year. That has increased by 11,000, the number of young people enrolled, which of course benefits all of us, as I've said. So we want additional subsidies. We want to make those youth subsidies permanent, and we want subsidies for older people. And the
So-
third, I'm sorry.
Go ahead.
Third category are immigrants who are barred because of federal rules from getting healthcare coverage. And, you know, that's personal to me. I'm an immigrant. And, you know, it's just unconscionable that people, because of their immigration status, are barred from getting healthcare coverage. These folks pay taxes, many of them. And when they go to the hospital, it's the same hidden healthcare tax. So our proposal would, number one, have automatic enrollment, number two, additional subsidies, and number three, remove all immigration barriers. And we believe if we do those three things, we'll come as close as a state can come to 0% uninsured.
So if folks want to learn more and read more, you can look up Vinny DeMarco in the Baltimore Sun. He did a great op-ed that you can read. Let's pivot for a second to tobacco cessation. Talk about your work in that area and why all these years after the tobacco lawsuit settlement and stuff, why are we still fighting? What's the biggest hurdle we're facing with getting people not to smoke or to stop smoking?
Well, it's an excellent question. First of all, we have, as you know, thanks to you and others, made a lot of progress. Smoking has decreased by 30 or 40% in Maryland. And one of the reasons is we've constantly increased the cigarette tax. Mm-hmm. Cigarette taxes save lives, reduce smoking, especially amongst young people. They're very, very effective. And we also have good cessation programs for people who have a hard time quitting despite the tax going up. So that's good. We have one of the lowest smoking rates in the country in Maryland. Mm-hmm. However, we have a very powerful tobacco industry that uses techniques over and over again to try to get around that, including the new vaping, relatively new vaping, which is out there, which is not covered by some of these taxes. Some yes, some no. Mm-hmm. So we need to keep up on that. I mean, it really is a situation where the more we prevent these horrible illnesses and deaths by reducing smoking, the better off, again, we all are by reducing the pressure on our system.
Is the Tobacco Coalition effort talking about cannabis? Do you have a position on that?
We have no position on that. And I don't know. That's a whole different
thing.
Whole different world.
So let's pivot for a second as we start the wrapping up here. Michael Perchuk wrote a book about you, talking about the DeMarco Factor, and called you a latter-day Don Quixote, which I think is extraordinary and accurate. You take on these battles and it's like, Vinny, love you, but no chance. And then you get it done. So talk about the book. What was it like to have a book written about you? Do you like it? Is there anything that was embarrassing or that you disagreed with? Just talk about that. And Michael Perchuk is like a tremendous leader, former head of the FTC, Federal Trade Commission. I mean, yeah. So talk about that.
One of my all-time heroes and an adult mentor of mine who in fact, Senator, my wife, Molly, and I were just visiting him last week in Santa Fe, New Mexico, nice. And talking about the book and everything. It was wonderful to be with him. And he did so much to be part of what you're saying in reducing smoking. He devoted his life to that after being the chair of the FTC and working in the Senate for so long to pursue progressive measures. But he is really one of the people responsible for the success of the tobacco control movement.
But talk about the book. Talk about you.
The book, he and I worked together on reducing smoking. He was impressed by my work and said, we're going to write a book about it. And I really, really enjoyed working on that with him. And it is embarrassing at times, and it has a lot of stories in there that are very, very funny. And I can urge people to read it, since he gets all the royalties, not me. It's a DeMarco Factor. And I love his subtitle, Transforming Public Will into Political Power. And that's the essence of the book. Yeah. The book is about situations where the public supports
Like in gun
something.
control.
Yes, gun, tobacco.
Although you don't want us to call it gun control
No,
anymore.
gun violence prevention.
Gun violence prevention.
Gun violence prevention. We're not against the gun. We're against the using gun violence. And there are good, smart ways to do that, like we talked about before, licensing handgun purchasers. But the book is a very good, in-depth description of how you do that, how you take public will, transform it into political power, and make public health happen. And there's some great stories in there about my sons also, which I think are wonderful. Yes.
That's my next question. So your son, Jamie, is just a powerhouse. He is such an effective advocate also. So the genes, the fruit didn't fall far from the tree, or, he got the genes and stuff. Talk about Jamie, because.
Well, you're so sweet to mention Jamie.
Best. One
of your former colleagues, Senator Madaleno, said to me, Vinny, Jamie's much better at this than you are. You should form a lobbying firm and call it DeMarco and Father.
That's very funny.
That's like Rich, right? So Jamie and I worked together on a campaign called the Clean Energy Jobs Initiative that after you all passed legislation to increase the percentage of Maryland's energy that's renewable from 25 to 50%, which succeeded. Thank you for your vote on that and support and leadership. And now Jamie is working with the Chesapeake Climate Action Network to get the bill passed in Congress, the reconciliation bill, to add hundreds of billions of dollars to clean energy. And you're hearing it, or it's gonna happen. I believe it's gonna happen.
I have to tell you, I had one of my nonprofit bills. I was having my hearing in the Budget and Taxation Committee, and Jamie said, yeah, I'll testify for it if you want me to. He had no notes. I don't know if he read the bill. I don't know what his homework had been. I don't know what his plan was. He goes up there and just badass, just boom, boom, boom. And I was pretty well prepared and I was pretty good, but Jamie just killed it. He was amazing.
Well, Cheryl, in the book, he was a little boy.
Yes.
And what's in the book is that I was being interviewed by a reporter from the Baltimore Magazine. He was like 6 or 7 and he was there. He suddenly jumped on the table in the restaurant and started singing, I am I, Don Quixote, the Lord.
Man of La Mancha, one of my great Broadway musical. That's amazing.
Yes.
So the last question before we pivot, have you thought about, so I know that other states have tried to mimic and some of the work that you've done and replicate it. Have you ever thought about going national, bringing your efforts to Congress and stuff? How much of that have you done? Talk about that, other states and national.
It's a good question. And other states, I'm very lucky to work with funders who encourage us and fund us to help other states.
Nice.
On easy enrollment, several states have done that. And, with your help, we passed in Maryland in 2019, the first ever prescription drug affordability board law to make high cost drugs more affordable. Several states have passed those laws, and the Arnold Foundation funds us to help other states replicate our success. And at the national level, you're my hero, of course, is Senator Chris Van Hollen. And whenever we pass something good in Maryland, he puts it in at the national level. He's got a national easy enrollment, auto enrollment bill. He's got a national prescription drug affordability board bill, called the We Paid Act. Yeah. So he is a great leader in getting things done nationally. Maryland's so lucky to have him.
And we are so lucky to have you, Vinny. So 2 things about that. First, we've got to say that we want our Senator Chris Van Hollen to be back to excellent good health. He is back, he is working, and he's still listening to his doctors. So that's good, but we need him back at 1,000% when it's appropriate to do so. And then second, Vinny, when you were talking about the Prescription Drug Affordability Board, there are a lot of us, including me, who, I have high-tech biotech companies in my district and it's jobs. And so you're very kind to give me all sorts of props, but it's a struggle sometimes. You come in and you say, I want all of this. I'm like, okay. But you are such a brilliant tactician in the way that you negotiate and balance, because obviously I want drugs to be affordable. Obviously, I want consumers to be able to afford the prescriptions they need. And yet we also need the jobs and we need the incentive to do the research. And you have you've come in with the nth degree, but then understand that sometimes, compromise and dialing back is needed. So congratulations.
Well, thank you. And we made sure that the drug manufacturers are represented on the stakeholder council
Yes.
that works with the board as well as consumers and others. So yes, absolutely. This is not a us versus them. This is working together to make high cost drugs more affordable.
Yes. So before we go to the fast five, is there anything we didn't talk about regarding healthcare that you want to share briefly?
Well, I would just ask people to go to healthcareforall.com. And if you want to see our one pager, I have brilliant folks who work with me, Cheryl, who know how to do this, which I don't know how to do. But if you go to healthcareforall.com/resolution, you'll go right to the resolution. You'll see all the groups that have endorsed so far. You could read the one pager and sign on. So if you like what we're talking about, we'd love you to sign on.
Perfect. And we will have a slide, as you know, with all the social media and stuff at the end of this tape. So you'll be able to check them out on Twitter and Facebook and everywhere. So, all right, Vinny DeMarco, fast five quick questions, 5 quick answers to let folks know more about you. First, question number 1, is there a hobby that you picked up during COVID?
Yes, I do Zoom Shakespeare stories for little kids. Nieces and nephews and other kids. I love Shakespeare, and I do these 20-minute renditions of Shakespeare plays that started during the pandemic and is going to continue forever.
And do you compress them, or are they out there?
Oh yes. Oh no, I do myself. I read it very carefully and I compress it myself, and they love it. Like in 12th Night, some people are born great, some people achieve greatness, and some people have greatness thrust upon them. So I use lines like that to do it. Sure, I love it.
Where can people find that if they want to watch? Do you have a YouTube channel?
I do. My wife created one. I'll send it to you.
Of course, Molly had to do that.
Yes, I could not do that.
Question number 2, what is your favorite foreign cuisine?
Pasta.
Okay. Question 3, what is something you've done that you will never do again?
Whoa.
Isn't that a cool question? One of my interns came up with that one.
That's a cool question.
Yeah.
What something I've done before I'll never do again? Scuba diving.
Okay. Okay.
That's it. Yeah, I've done it. That's it.
Okay. Question number 4. Tell us very briefly about a family tradition, a favorite family tradition.
Making homemade tomato sauce. My family used to do that every year when my parents were alive, and we made hundreds of jars.
Dang.
And it's a great thing. And Molly and I made a few jars so I could give one to Chris Van Hollen when we did the event he was supposed to come to. He couldn't make it. His wife got it. So that was it. Making homemade sauce.
I got to get on your Santa Claus list or something.
Yeah.
And the 5th question, Vinny DeMarco. What is your hidden secret superpower? What is a skill or talent you have, something that most folks can't do?
Bicycling constantly, including 100 miles whenever I can. This morning, like every morning, I get up at 4:30 a.m. and do a 24-mile bike ride to Loch Raven Reservoir nearby. I'll send you some pictures. It's beautiful. So I bike as much as humanly possible.
Wow, we almost could have overlapped. I went to bed at 2:30. So,
we talked about this one, Senator.
Hey.
We're on different times.
That's amazing. Different time zones almost. Well, Vinny, thank you for all you do. Thank you for your friendship going back to the 1980s, early 1980s. And just thank you for your passion and your service and for creating the next generation of advocates who are going to continue to make a difference. So great to see you. I look forward to seeing you very soon in person.
Thank you, Senator. You're a great leader.
Thank you. Stay well. Take care.